Okay, my name's Natalie, and my speech is over the American Cancer Society. This is my note card, and these are my audience. Think about this for a second. In the time that it takes me to give this speech, about 8 people in the U.S. will be told that they have cancer. That's how common it is. Almost every one of us knows someone, a friend, a neighbor, or a teacher who has been affected. Cancer is one of the most serious health conditions in the world, and that's why I chose to talk about the American Cancer Society. It's one of the biggest and oldest cancer organizations, and having been around for over 110 years, a lot of people have heard of it, but many don't really know what it is. When we hear phrases like cancer research or awareness, we tend to tune out because those words are so common, but the truth is, the ACS does so much more. While I've never worked with them directly, I spent time researching what they really do. Today, I want to help you understand how the American Cancer Society works, what it offers, and why it matters. So first, let's look at how it sets up. The ACS was founded in 1913 and is a national nonprofit with regional and local branches all over the country. So even then, it's a big organization. It works right in our communities, led by a board of directors and supported by thousands of staff and volunteers who help run programs. Now that we know how it's structured, let's talk about what it actually does. So one of the important things the ACS does is fund cancer research. Since 1946, they've invested over $5 billion to support scientists working to prevent, treat, and cure cancer. But their work goes far beyond labs and studies. They support patients in real time. The ACS has a 24/7 helpline for questions and guidelines. For someone going through chemo who doesn't have transportation or lives far from a treatment center, the kind of support can be life-changing. They also work on a bigger scale, fighting for public policies that make healthcare more accessible, pushing for tobacco regulation, and helping improve cancer screening coverage. All of this is powerful, but the real question is, does it actually work? Since 1991, the cancer death rate in the U.S. has dropped by 33%. That's an estimated 3.8 million dying from cancer. And the work of organizations in the ACS is a huge part of that. They've helped pass smoke-free workplace laws, push for tobacco taxes, and created programs that reduce factors like smoking. In just one recent year, they provided over 480,000 nights of free lodging to cancer patients and gave them more than 341,000 rides to form treatment. That shows how the ACS is impacting lives on both an individual and national level. Whether it's helping one person make it to whether it's helping one person make Cancer Society in every step of the way. Let's wrap. Okay. Basically, ending the Cancer Society is more than a name. It's a pink ribbon. It's a major force in the fight against cancer, working through research, patient services, and public policy to save lives. We've talked about all the struggles and how it's structured, and the fundraising and the Relay of Life event. So I hope you'll think about what's really behind it and how much of a difference it makes every single day. Thanks to the ACS, no one has to face this alone. Thank you.